It's another session of the platform. My name remains Oluwalose Ifumida Silva.
I'm Dr. Bukola Ropo-Oyibo. I'm a medical practitioner.
Dr. Oyibo, you are welcome to the platform.
Thank you, sir.
Yeah, I want to know your views about family planning. What does it really entail?
Family planning are methods that are required to prevent pregnancy and is a way of spacing children and ensuring every child is coming with a plan, not accidental pregnancy as the case may be. So it's one of the ways the family can improve their well-being by planning how a child is coming, how often they want to have children, and it can actually be used to determine the number of children that somebody will want to have. It had been around for quite a while, and it's been promoted at different government policies and programs, and a lot of people are buying into it, though it's still not generally acceptable in some parts of the country as the case is. But then it's just basically means of preventing unwanted pregnancy.
Okay, there is this myth that family planning is ideology of the whites to control the population of the blacks. Is this really true?
Well, I cannot say it's absolutely wrong, but then there's hardly any policy that will not have its own criticism. I believe it's one of the critics that are promoting that. But when we want to look at it, we want to check, is he beneficial? Does he have any importance to us? Do we really have any reason to control the family size? So, and I want to believe that even before now, in the olden days, I hear stories of some traditional methods that people use to prevent pregnancy one way or the other. So it's not true, if I'm to say it, to my own understanding and to the level of my knowledge, is not true. It's not a wide agenda of a population. Fine, it can control population, but then if we look at it with the kind of life we have now, it's something everyone should embrace. It's more beneficial.
Okay, as a practitioner, have you ever come across some of those who engage in family planning come back with some experience that is not palatable?
Yes, a few people will have some side effects, like we say, but then there are a lot of reasons someone will have side effects. Because we have different kinds of plans and family planning methods, some persons may just subscribe to anyone they feel like without necessarily going through the normal medical checkup. So such people tend to have more side effects. Then the other thing we tell people in the family planning clinic is, okay, we want to recommend this method, but if you have any complaint, you can come back. Because we still give room for, if one particular method is not suitable for you, you can easily switch to another one. But oftentimes those side effects, if reported on time, they are not life-threatening, so to say.
Insinuation that family planning causes infertility. Is it true?
Well, I don't know. It's not. There are different methods, like I said earlier. There are some methods that take longer time to be reversed. So if somebody is using a method that has a long active time, such a person may not be able to achieve pregnancy as quick as they want it. But other methods that are shorter, are easily reversible. So that is why when people go to the family planning clinic, a method that is introduced to them is based on how many children they've had, and whether they still want to have more children and how soon they want to have another child. So that will determine the kind of method. So it may delay pregnancy, but it will not cause family planning. There are many other factors that will easily cause infertility, and family planning is very, very low. Like, it's just very far away among all the factors that will result in infertility.
Okay. This same family planning is being introduced among teenagers and youths. Is it advisable?
Well, in more developed worlds, is the norm. They have their own reasons for embracing family planning in the teenagers. They think they should prevent early pregnancy, such that it won't affect their schooling, their growth, and several other reasons. Well, it's a thing of culture and belief. We cannot say, in as much as we cannot totally say they are wrong, because they are looking at it from a certain perspective. But if you want to look at it on a religious perspective or from the perspective of culture, so we have other cultural means and even religious means of making sure that the young ones don't engage in sexual activity until they are ripe of age. So if those methods are effectively implemented, we may not need to say family planning should be introduced at that young age, because most of the methods, there are so many of those methods that we can't even give at that young age. So I don't think it's the best. So, but then we can't totally say it is wrong.
All right. There are some critics that say, since those younger ones don't have a family, so what are they planning? Do we need a better name for it to make it more acceptable?
Well, for them, we call it contraception, just contraception. So it's family planning was coined out of I think it was coined to just make it understandable for the common man that, okay, when you use this, it will help you plan your family. But it's just another name. But the actual name of what is done is contraception.
Thanks for coming on this program.
Thank you, sir.